Hey there, everybody. Welcome back again to another fun and exciting episode of the Anatomy Show. I'm your host, Mr. Taylor, back again with more exciting stuff. So today we are going to start learning about some of the anatomical regions of the body, and we are going to talk about different planes and sections that the body can be divided into, and all sorts of fun stuff like that. So today's going to be a big anatomy day. So to start off, I have 10 questions here for your warm-up. These are regions of the body with their common name given, and I'm asking you to give me the anatomical or medical term for each of these. Now, if you did the summer assignment, these should look very familiar to you. So just take a second and try to answer these now. Okay, so I'm assuming that you've gotten your answers, so let's go ahead and go through these. So if you did the summer assignment, you shouldn't even have to guess, but maybe you forgot. All right, so nose, we use the word nasal. Now, you may see sometimes that they use the prefix rhino, like a rhinoceros, like rhinoplasty, but we're not going to really use that too much, but that is used medically. For mouth, we're going to use oral. And the reason why I'm ending these in AL is meaning like related to. So you could have written like nasus, Nasus, um, but nasal means like related to the nose. Nasus is like the nose itself. So like you have like nasal passageways, nasal congestion, oral cancer, oral, whatever, oral hygiene. Okay. Um, for belly button, a lot of people put navel down because that's like the proper term for it, but it's not the medical term. It's umbilicus. And so related to that, it's umbilical. I forgot an I in there. Umbilical. There we go. Perfect. Finger, we usually use digital, like your digits. Hand, we use manual. I always think of like manual labor, or like a manual transmission. Wrist, you've probably heard of these before. Carpal, like the carpal tunnel. The bones in your wrist are also called the carpals. Your thigh would be your femoral region. Hey, I've been practicing my handwriting. How am I doing? Okay, good. Thanks. All right, for foot, we're going to use pedal, like put your pedal or put your feet on the pedals, right? Isn't that funny? Like, so you put your feet on the, okay. Thighs, femoral, like your femur. Okay, there you go. Buttock, a lot of people know this one. Gluteal, 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 like the gluteus maximus. And then for back, the best one for this is dorsal, but I've had people give me like vertebral. That's kind of more like referring to like your backbone, but either one's fine. We'll take either one. Great. So how'd you do? 10 out of 10? Awesome. All right. So now today we're going to talk about the anatomical terms. And when we speak anatomy, we have to speak a common language. That's really important. So we have to make sure we're all on the same page and we all agree on what all the things are. So when we talk about anatomical terminology, first of all, we have to decide how we're going to look at our patient or the person we're talking about. So they came up with this thing called the anatomical position. And the anatomical position is really simple. You have a person that is facing you, face forward. They have their arms out at the sides, straight out with fingers, you know, I don't usually draw my stick figures this, detailed, but you got it. So palms forward, facing you. I guess we'll give them a trunk. Feet also down on the floor and facing forward. So that's the anatomical position. If you want a much better look at this guy is in the anatomical position. So as you can see, face forward, hands palm forward, feet flat on the floor. And the reason for this is that, you can like rotate your hands back and forth. And so like a lot of times, you turn your hands sideways or whatever. This is just the common position. And the reason for this is we can describe every part of the body from this same position. So it's kind of like, if he were to cross his arms or cross his legs or sit down, all of a sudden the parts are in different locations relative to one another. So that's the position we use. All right, so we have the anatomical position, which is where this little guy is. You can also have a person who is prone, and prone is when you are face down on the ground. So if I just like fell forward, still smiling, that would be the prone position. Opposite of that, and so this would be the ground here, opposite of that is supine, which is where you're face up. Hey, and your back's down. Okay, so that's supine. And a really dumb way to remember that is there's a lot of dumb ways to remember this, but somebody once said to me, like, Superman flies above the city or whatever, and like your face up, like you're looking up to see like Superman or something like that. I don't know, whatever. But yeah, supine and prone. I remember prone. This is really weird, but if you ever do like rifle shooting, if you ever have to do anything like that, I was a Boy Scout, so we had to do like a rifle shooting merit badge. The prone position is a position that they shoot from. So like when like soldiers have to lay down on the ground and like shoot at like the enemies, that's considered the prone position. All right, so we did that. Anatomical position, check. Prone, check. Supine, check. Now, when we look at the body, there are 5 regions that make up the body. This part up here is the head. Down below the head, this region is called the neck. It's like where, the head kind of gets skinny as it gets hooked onto the trunk, unless you're Sarkis, in which case it's just the same size. Then we have over here, this region we call the trunk, which is like your, chest and abdomen. We have your upper limb, which I'm going to call UL for short, and you have your lower limb. Now, why don't we call it arm and leg? Reason why is because there's specific regions of the upper limb that's called the arm, and there's a specific region of the lower leg that's called the leg. And then we can break these down into many more regional terms. Now, one other thing, head, the region that we call the head, we call cephalic. That's its like really technical term. The neck we call cervical region. Now, you may have heard cervical before, like for cervical cancer or something like that, or like the cervix. And basically what it comes down to is I'm going to attempt to draw a uterus. So get ready. All right, let's say that's a uterus. Okay. This region down here is the cervix. Okay. The cervix is like the neck of the uterus. See how like head, neck, I'm not going to give it a face. That's gross. But anyway, yeah, the cervix is like the neck of the uterus, just like this is your cervix of your body. Okay, so moving right along, there's a ton of anatomical regions. You were supposed to study these in your summer assignment, but we're going to study them again. We're actually going to play a game to review this tomorrow in class. So tomorrow. So anyway, when you look through these, definitely take some time and study these. You have to know all these terms because we're going to use them all year. So when you go through, a lot of these will be new to you, but a lot of them should sound familiar. For example, like dorsum or back is the dorsal region, right? Like a dorsal fin. So if this guy was a shark, he would have a big old fin sticking out of his back. Let's see here. Another one, lumbus or lumbar. You ever seen those pillows that old people get that kind of look like a little cylinder that they stick like behind their back? And it like fills in this region. The small of your back is the lumbar region, and people usually have a lot of back pain here. Like people have like lumbar hernias and all sorts of nastiness. So this is why we talk about the lumbar support of the lumbar region. Okay, loin is kind of a weird word. We never use that. The sacrum. This is kind of a weird area just below that. You know how people have like those little dimples right here sometimes. Not that I've ever looked, but that little area between those little dimples and like the crack here, that's your sacrum, the little triangle. But then we have stuff like manus or manual. So like if you work with your hands, you do manual labor, or if you have a manual transmission. Gluteus, most people know this because you have like the gluteus maximus. Your femur, you guys probably already know, is your thigh bone. So anything in your thigh is femoral. Some of these are kind of hard. The planta is the sole of the foot. Like, have you ever heard of like plantar warts? Like sometimes people get those. Literally, they are called plantar warts because they're on the sole of your foot. So if you had a bunch of warts down here, that's what you got. Moving right along, let's see here. Oh, some of these are really easy. Oculus. You ever heard of those VR headsets? The Oculus. So that means like related to your eye. I use the word orbital a lot because like your eyes kind of go around and around in circles and look all over the place. So they kind of move around like orbits. Your cranium, you guys have probably heard this before. The cranium is your skull. Obviously, your face is your facial region. Not hard. These are kind of interesting, like your buccal region. That's like when they take like a buccal swab. So for example, like if any of you guys have ever had like seen like how they do those DNA tests or like the COVID tests where they swab inside of people's mouths, it's called a buccal swab. Check it out. Like audio, right? Audio, AU. We get ARIS, also known as the otic region, which sounds otic, sounds kind of like audio. Nasus, of course, is nose. We talked about the cervical region already. This is your thorax, like the part up here of your chest is the thoracic region. You've probably heard of thorax before. I think it's one of the parts of an insect you've probably heard of. The mammary region, I'm sure you know where the mammary area is. It's the breast. The abdomen, your belly, that's pretty easy. Your umbilicus, like where the umbilical cord would be connected if we were a baby, is your navel or your belly button right there. But then a lot of these are kind of hard, like hip is coxal. That one's tricky. Pelvis, I'm sure you guys have heard of before, the pelvic region. This one's weird. Inguinal region is the groin. That's like, this is kind of gross. I'm getting in dangerous territory. It's like your inner thigh. You know, you have like a little indentation in here, right? That's your inguinal region. Pubis, of course, is the pubic region. We already talked about the femur. Hey, look, they put on here twice. That one's pretty easy. And if you go to the other side here, like the oris, oral region would be related to your mouth, of course. We all know that. Mental region is your chin. I always think of like when you think about stuff, you put your hand in your chin and you go, far out, right? So mental is chin. This one's tricky. Axilla is your armpit. I always think about like how like the axle of a car kind of like rotates around and your arm kind of rotates around your axilla. Brachium is your arm. Antebrachium is your forearm. Literally, like ante meaning like before, right? Like you ante up, antebellum, that kind of stuff. So antebrachium is the forearm. Antecubitus is the front of the elbow. So you see, we have ante here twice. So we have the brachium, which is the true arm up here above the elbow, the antecubitus, and the antebrachium. Carpus, like carpal tunnel syndrome, of course, is your wrist. We have the pollex or the thumb. I think that one's kind of a weird one to remember. The palm of your hand is called your palmar region. That one's easy. Okay. Your digits are your digital or phalangeal region. So phalanges are the names of the bones on there. So that one's pretty easy. A lot of people know that their patella is their kneecap. That's pretty easy. Now here's tricky ones. The crural region is your shin. The sural region is your calf. And so I always think, okay, in regular English, my calf starts with C and my shin starts with S. And you see how they flip them? So I always remember the anatomical words are backwards. So it's like sural versus crural. And they just switch the words on us just to make it confusing because, that's why doctors make lots of money. Anyway, because it's hard, right? Anyway, tarsus, your tarsal region is your ankle. That's what the bones down here are called. These are called your tarsal bones. And then down here on your foot, your digits are your toes. So the toes and the fingers actually get the same name. So the digital or phalangeal region has the same name. The foot we call the pedal region, like we said about like putting your feet on the pedals. And then your heel is called the calcaneus. And apparently your Achilles tendon that sticks off of here is called your calcaneal tendon. So that goes together. So as you can see, a lot of these you've already heard of before. Like, for example, we already said lumbar was one you guys have probably heard of with like lumbar problems. But there's a few weird ones. Olecranon. Olecranon's like the tip of your elbow near like, I believe someone calls it the weenus. I think I heard about that. That's called your olecranon. So that one's a little bit tricky. So there's a few you might have to study, but most of these are ones you've heard of. Oh, I almost forgot. The frontal region is your forehead. So this whole region in the front of your head is the forehead. So just practice this. It's in your book. Practice it because you have to know all these. They're going to be on the test, and we're going to play some games with them tomorrow. All right, let's go. All right, so related to all those anatomical terms, we have what are called the directional terms, and they tell us how to get around your body. Okay, so these are all paired on purpose. So superior and inferior. Superior means like up or towards the head. Okay, and that's why it's called also cephalic, literally going towards the cephalic region. Inferior would be like down or towards the tail. Now, I know we don't have a tail, but the word caudal actually means tail. We don't use that very much because we're humans and we don't have tails. But if you ever see that, that's what they're talking about. Anterior and posterior. Anterior means to the front, so that means forward. Posterior means towards the back. Some people refer to their rear end as their posterior, which is kind of weird. Vets use the terms ventral for anterior and dorsal for posterior. That's why sharks have a dorsal fin. So cephalic and caudal are also veterinary terms. I forgot to mention that, but we can also use them for humans too. Medial lateral. Medial is towards the midline. Okay, so you have you have this thing called the midline, which is like this imaginary line that runs right down the middle of your body. So imagine, like, here's you, and if we went and cut your body perfectly down the middle, that little guy is called your midline. So as we move in towards that midline, we're moving medial. And as we move away from that, we move lateral. And you might know in football, you can throw a lateral. And I know people say, oh, you have to throw it backwards. It's supposed to mean to the side, like you're throwing it sideways. Okay. So lateral is like away from the midline. So, for example, my eyes are lateral to my nose because they're kind of like closer to the side. My nose is medial to my eyes. My eyes are medial compared to my ears. So, if we go back to this little guy and give him some big old ears, right, those are lateral compared to his eyes. Okay. Proximal and distal. Now, if you look at this, proximal means like near, like proximity, and distal means far. But here's what this thing is. These two are used on the limbs only. I can't even tell you how many students get this mixed up all the time. Limbs only. And this means like near or far from the trunk. So check it out. If we look at our little stick figure over here, and I give him like the rest of his arm, hey, and give him some, oh my gosh, what happened? He like lost his arm. He's got leprosy. All right, the tips of his finger, these are the most distal, and his shoulder would be the most proximal. If I actually give him like real legs that come down, those are some short thighs. All right, the top in his hip would be the most proximal part, and the tips of his toes would be the most distal. So we have this axis moving from proximal to distal depending on how close we are to the guy's trunk. Okay, so this is used instead of superior and inferior. Okay, so superior and inferior are used only in the head, neck, and the trunk. Proximal and distal are used only in the limbs. Okay, but these two are very similar. So in other words, like if we were looking at a leg, this is me drawing a leg with a foot. All right, great. That's a knee. Okay, so it's the patellar region. Anyway, so if we were looking at this, as we move up, which direction are we moving? Oh, we're getting closer to the trunk. So this is going to be proximal. And as we move away, we're going to become more distal. Okay. Now, this sounds kind of dumb, but the reason for this is that if we were to look at a cat, so I'm going to do a cat stick figure, this little kitty, meow, okay, this little guy here is going to have, besides whiskers, notice how his legs and arms are at a different angle from his body. Like he's kind of like on all fours, so that we kind of go down the body, and also we have to make like a right turn to go out the leg. And same thing, we have to make like a turn to go out into the front legs. Humans, we don't have that issue because we are bipedal. But if you notice in the anatomical position, the hands are kind of sticking out, so they're not exactly perfectly like aligned with the rest of the body. So that's why the limbs use proximal distal. So be really careful. People always mix those up. All right, superficial deep. Superficial, as I'm sure you can imagine, means shallow or closer to the surface. Okay? And so like your skin is your most superficial organ. Deep, of course, is like deep. So I'm just going to write, wow, that's really terrible definition. Deep, it's like far from the surface. So this is something we use a lot more in like surgery. So if we were making an incision, I'd say like if you want to just cut through the skin, it's a superficial incision. If you want to cut all the way through like the skin and the muscles all the way down to the organs, it would be like a deep incision. So that's where we use that. And the last one, intermediate, is like in between. So this one we can only use in between other ones. So for example, like when I look at my my lower limb here, my foot we would say is distal, my thigh is proximal, but where does that leave the knee? Oh, it's intermediate. So it's neither proximal nor distal, it's in between, right? We use this all the time. Same thing, like if I said my head is superior and my trunk is inferior, where does that leave my neck? Oh, it's intermediate, it's in between. Okay, so here's a picture of a nice young lady in the anatomical position, and we can see all her directional terms laid out for us here. You can see how they all go in the same planes. And notice only in the arm and the leg are they showing proximal distal, everywhere else superior, inferior, or in this case, they're using cranial and caudal, so they're using the veterinary terms. And we can say medial lateral. Oh, also, no, left and right is the patient's left and right. So it's her left and her right. So if we wanted to go in and do a surgery and like remove her left thumb for some unknown reason, we would go on her left, not our left, right? So you would cut this thumb off and not the other one. So just be careful about that. By the way, true story, you know, they actually write on patients. So if they were going to like do surgery on her eye, the surgeon actually comes in and is like, this one, and like signs their name. And so that way they know like which eye to take off. Oh, this poor woman. Okay. Anyway, we're going to practice with this. We're going to use this picture later just to practice our anatomical terms. But you can see like everything's very complex, but you know, we'll practice. All right. So planes and sections. Basically, if you look at the human body, there's a few different ways we can divide the body. So let's say we were looking at a person's head. And let's say we wanted to look inside their head to see some different structures. There's some different ways we could cut it. We could take this head and we could cut it down the middle, or we could cut it in the same direction, but not quite in the middle. Like we could kind of slice it like lots of different ways. This is like some real like serial killer level stuff, isn't it? Or couldn't we also take this guy and let's give him a nose. Whoop, there we go. We could also cut the head different ways like this, like front to back. And we get completely different views. And we could take a third head, because like why not, right? And we could cut it like top to bottom, right? And so these are where we see the planes and sections. So the first set is called sagittal, and this splits us into like left and right sides. And so that's what I drew here. This guy right here is a sagittal section, okay? And so the sagittal plane is this little dashed line. It's an imaginary line going through something. Now, if we actually cut a head this way, we would make it into sagittal sections. So sections are cuts, and planes are just kind of like theoretical lines. Just imagine that they're there, okay? So the sagittal splits us into left and right sides. Now, one of these goes through the very middle, and that is called mid-sagittal, okay? And it's like perfectly in the middle, okay? And so it would create two perfectly matched sides. Any one of these on the sides off from that are parasagittal. So we can draw another one here. It's parasagittal. And these are not in the middle. So in each person, you have exactly one mid-sagittal plane and infinite parasagittal planes. Because if we went like a millimeter off from this, it's parasagittal. All right, frontal, also known as coronal, is this guy over here. I don't really use coronal that much, so you're going to hear me use frontal a lot. Frontal divides into like an anterior, posterior sides, or what you might call front and back, but we're using anatomical terms here. So it splits into front and back, and there's infinite numbers of these. So if we just snipped off the very front of this guy's nose, that's frontal. If we cut the very, very, very back of his head, also frontal. So there's infinite numbers of ways that we could slice this head. But these are all planes, so just theoretically. All right. Transverse, this one's going to do into superior and inferior sections. And so that's what this guy is over here. This is our transverse. Now, we also call this a cross section because we go like across, like from left to right, but we end up with like the superior and inferior sections. And once again, there's infinite numbers of these. You can cut as many as you want. The last one that I didn't draw on here is oblique, and this is any other angle. So if we decided to take a head and we were just like, hey, let's just go like at a 45, why not? Or if we decide to go at like a 30-degree angle or a 20-degree angle or whatever angle you want, those are all obliques. Guess which one of these things we use the least? Wow, that's supposed to say oblique. Anyway, oblique is the rare one. We hardly ever use this. So this one's kind of like a rare bird. We'll never find it. These other ones, sagittal, frontal, transverse, we're going to use all the time. So let's see some examples. Whoops. Oh, okay. So here's an example of a lady that had a really bad accident at the plate glass factory. Just kidding. This lady has been divided with these planes. So once again, planes are theoretical. We didn't actually divide her, but we're just imagining a line going through her. So frontal, splitting her front back. This is sagittal. It looks mid-sagittal to me. splitting under left and right, and transverse going top bottom. But you can move these up or down. So this transverse plane exists here, but could also exist like through the neck or the top of her head or the bottom of her feet. So there's infinite transverse planes, just like there's infinite frontal planes going from front to back, and there's infinite parasagittal planes from left to right, but only one mid-sagittal. And so the reason why is this useful? Like, why do we care? Hey, so check it out. Let's say we want to look at a brain. We could look at this brain in a transverse section. It looks like a walnut, but you can see really good inside the inside part. This is actually the vesicles, the ventricles, which are the hollow parts of the brain. And you can see the, let's see here, you can see the hemispheres very clearly in the white matter. It's really nice. It's a great view, okay? If we look at it in frontal section, we cut into like a front back, and we're looking from the front towards the back. So this is what the back of the brain looks like. And it still looks like a walnut, but we get a different look. We can see the corpus callosum here that kind of connects the two hemispheres. We can see the ventricles underneath, completely different view. And then when you do a mid-sagittal section, this is the more traditional view that we usually get, where now you can see the corpus callosum in a completely different way. You can see the ventricle in a completely different way. You can see the brain stem, all sorts of different parts. So the idea is we get different views from each one of these and different information. So we mix them up a lot. This is kind of gross. Should have warned you. But this is a photo of an actual human cadaver head that was split at Carlow University. And they did a sagittal section of this head. It is almost perfectly mid-sagittal, but unfortunately it's considered to be parasagittal because the one thing that's missing is the nasal septum. That really thin little bit of tissue in between the left and right nostrils is missing. But this is what the inside of your head looks like, sagittal section. They actually did a transverse section up here to take the brain out.